Approximately 3 million young athletes will experience concussion in the United States this year. A concussion can lead to permanent loss of an ability to think clearly. That's why it's so important for us to have the tools to recognize a concussion early. We are putting America's greatest asset at risk every time an athlete goes on the field. My name is Dr. Anthony Alessi. As a neurologist involved in sports medicine, I get to witness the devastating effects of concussion. A concussion is a syndrome of immediate and transient neurologic impairment as a result of a mechanical force on the brain. This can be a blow to the brain or the sudden jolting of the brain within the hard skull forward and backward. If a concussion is not diagnosed early, it can lead to persistent symptoms of headache, dizziness, incoordination, and potentially a permanent loss of an ability to think clearly. That's why we know from our studies that the best treatment for a concussion is early recognition.
Hey everybody, it's radio talk show host Lee Elsey. I'm also a former professional baseball player. I played with the St. Louis Cardinals as well as overseas in Amsterdam and Australia. Now today we're here talking about concussions. I know, I've had them. Now the state of Connecticut has enacted a law for high school coaches and trainers. They have to go to school to learn about concussions. Now today we want to talk about the younger kids, the kids in the youth football leagues. There's not really any special law enacted for them, but we want to make sure that you go and get this information. You need this information because these kids, they're growing, they're developing at this age, and a concussion for an 8-year-old is more severe than a concussion for an 18-year-old. It makes a bigger difference. So Backus Hospital is trying to help out and get information out on concussions. Now you can go to their website, backushospital.org/concussions. It's Lee Elsey. You guys have a great day.
Hello, my name is Jamal Davis. I'm the head football coach at Norwich Free Academy. Today we're going to discuss concussions and what we can do as a community to at least minimize the chance of having a concussion at the youth level. And I can tell you personally, I had a concussion. I've seen concussions as a player and also as a coach. And these things are very serious, and I think it's important that we become aware of how we can be very proactive in preventing them. As a youth program, I think it's important that we focus on the fundamentals of the game. I think part of that is teaching kids proper technique. Not only with proper technique, it's important to understand proper fitting of equipment, not only for the coach, but also for the player as well as the parent. Just trying to remind the kids about making sure that they constantly monitor their helmet. The other issue, as I mentioned before, is sizing of the helmet. At the youth level, I feel there are a lot more issues in terms of sizing. The kids are developing at different rates, and it causes situations where the helmet manufacturer may not necessarily have the proper sizing initially. And then now the other piece, as I mentioned, is fundamental. Making sure the kids understand the importance of tackling properly. We spend a lot of time in teaching proper tackling technique. We know that concussions happen in football, but I think it's also important to recognize that concussions happen in all sports. We've seen many times our athletes attempt to say, I just got my bell rung. Well, we've got to really focus on trying to prevent eliminate the culture where it's acceptable for having your bell rung, because your bell rung is a concussion.
My name is Cassie Curry. I'm the mother of 2 boys, ages 11 and 7, who play football with the Montville Youth Football League. And I'm also a registered nurse that works in the convenient care section of the emergency department. As a parent, of course, I want to keep my kids as safe as possible in any sport that they play. However, when it comes to concussion awareness, it's a team effort that's required, and everybody needs to be involved. The coaches, the parents, the players, the referees, and the EMS providers on the sidelines. On July 1st, the state of Connecticut passed a law requiring that all high school or scholastic level coaches attend a course about concussions. This would teach them the signs, the symptoms of concussions, and also the risks of concussions, and kind of give everyone uniform guidelines on what to do if they suspect that a player has a concussion. This is great. However, there's nothing that's being offered yet to youth level or the pre-high school level coaches. And it's an important subject. We have youth kids out playing. We need the teaching there for them also. As a nurse at Backus Hospital, I'm trained to recognize the signs and symptoms of concussion. Some of these signs and symptoms are if after a blow to the head or body, the player complains of headache or pressure in the head, if there's a loss of coordination or balance, if they appear stunned, dazed, confused, complaining of vision blurriness or doubled vision, if they can't remember what happened right before or after the injury occurred, loss of consciousness, dizziness, and if they just appear more moody or suffering from emotional changes. There are things that we can do to prevent concussions, things like educating our parents and players and the coaches, having the players wear protective equipment, their helmets of course, but also making sure that their helmets and other protective equipment are fitted properly on them. And then also making sure that players are trained to correctly tackle and to receive the hits. No heads down type tackling is very important. We're excited about the effort that Backus Hospital is making to teach coaches, parents, players at the youth level information about concussion.